Hello, and welcome back to our channel. I'm here today to talk about something that affects millions of people over 45. Respiratory health. If you've noticed, you're getting winded more easily, catching colds that seem to linger longer, or you're concerned about protecting your lungs as you age, this video is for you. Today we'll cover the most common respiratory diseases affecting adults over 45, why our lungs become more vulnerable with age, and most importantly, what you can do to protect yourself and manage these conditions effectively. Let me start with some important news about what happens to our respiratory system as we get older. After age 45, several changes begin occurring in our lungs and airways that make us more susceptible to respiratory problems. First, our lung tissue becomes less elastic. Think of it like a balloon that's been stretched many times. It doesn't bounce back as easily. This means our lungs can't expand and contract as efficiently as they once did. Second, the muscles that help us breathe, including our diaphragm, naturally weaken with age. This makes it harder to take deep breaths and clear mucus from our airways. Third, our body's natural cleaning system for the lungs becomes less effective. We have tiny hairs called cilia that sweep dirt and germs out of our airways. But these slow down as we age. Finally, our immune system doesn't respond as quickly or strongly to infections, making us more vulnerable to respiratory viruses and bacteria. These changes explain why respiratory diseases become more common and more serious after 45. But here's the good news. Understanding these changes means we can take specific steps to protect ourselves. Let's talk about the 5 most important respiratory conditions that affect people over 45. First is COPD, chronic obstructive pulmonary disease. This is actually an umbrella term for conditions that make it hard to breathe, including emphysema and chronic bronchitis. Here are the sobering statistics. COPD affects about 10% of people over 40, and that number jumps to 25% for those over 70. It's one of the leading causes of death and disability in older adults. The main symptoms include persistent cough, shortness of breath during daily activities, frequent respiratory infections, and fatigue. If you're experiencing these symptoms, especially if you have a history of smoking or exposure to air pollution, it's crucial to see your doctor. Second is asthma in older adults. Many people think asthma is just a childhood disease, but it can develop at any age or continue from childhood. What's particularly concerning is that asthma in older adults is often more severe and more likely to be fatal. It's also frequently misdiagnosed or undertreated because symptoms can be mistaken for other age-related health issues. Third is pneumonia and respiratory infections. Adults over 65 are at much higher risk for hospitalization and death from infections like influenza, RSV, and COVID-19. Most deaths from these respiratory viruses occur in older adults because of weaker immune systems and the presence of other health conditions. Fourth is ARDS, acute respiratory distress syndrome. This is a severe condition where the lungs fill with fluid, making it extremely difficult to breathe. While it can affect anyone, the risk of death from ARDS increases significantly with age. Even survivors may have lasting lung damage. Fifth are viral respiratory infections like the flu, RSV, and COVID-19. These infections hit older adults much harder than younger people. The combination of weakened immune systems and existing health conditions means these infections can quickly become life-threatening. What makes all of these conditions more dangerous after 45 is that they can lead to secondary complications like heart failure and increased risk of other infections. Now let's talk about what you can do to protect yourself. Prevention is always better than treatment, and there are several powerful strategies you can use. Vaccination is your first line of defense. This cannot be overstated. Vaccines are one of the most effective ways to prevent serious respiratory illness. You need annual flu shots, updated COVID-19 vaccines, and pneumococcal vaccines. These vaccines significantly reduce your risk of severe illness and death. Talk to your doctor about which vaccines you need and when. Smoking cessation is absolutely critical. Smoking is the leading cause of COPD and dramatically increases your risk of all respiratory diseases. If you smoke, quitting is the single most important thing you can do for your lung health. It's never too late to quit. Even people who quit in their 60s and 70s see significant health benefits. But it's not just active smoking. Secondhand smoke is also dangerous. Avoid environments where people are smoking and make your home and car smoke-free zones. Air quality matters more than you might think. Minimize your exposure to air pollution by checking air quality reports and staying indoors on high pollution days. If you work in an environment with dust, chemicals, or other airborne hazards, use proper protective equipment. Personal protective equipment isn't just for healthcare workers. During outbreaks of respiratory viruses, or if you're in crowded indoor spaces, wearing a mask can significantly reduce your risk of infection. This is especially important if you have underlying health conditions. Hand hygiene and infection control are fundamental. Wash your hands frequently with soap and water for at least 20 seconds. Use alcohol-based hand sanitizer when soap isn't available. Avoid touching your face and stay away from people who are obviously sick. Lifestyle factors play a huge role in respiratory health. Maintain a balanced diet rich in fruits and vegetables, which provide antioxidants that support lung function. Exercise regularly. Even moderate activity like walking can strengthen your respiratory muscles and improve lung capacity. Managing other chronic conditions like diabetes and heart disease is also crucial, as these can worsen respiratory problems. Regular medical checkups are essential for early detection. Many respiratory diseases develop slowly, and early symptoms can be subtle. Regular visits to your doctor can catch problems before they become serious. Don't ignore persistent coughs, increasing shortness of breath, or frequent respiratory infections. If you do develop a respiratory condition, the good news is that there are effective treatments available. However, treatment often needs to be tailored for older adults due to increased risk of medication side effects and other health conditions. For COPD management, the mainstay of treatment includes inhaled bronchodilators, which help open up your airways, and corticosteroids to reduce inflammation. Many patients benefit from pulmonary rehabilitation programs that combine exercise training, education, and support. In advanced cases, supplemental oxygen therapy or even surgery might be necessary. There are also newer biologic therapies, like dupilumab, that target specific inflammatory pathways. These represent exciting advances in treatment options. Asthma treatment typically involves inhaled corticosteroids to prevent symptoms and bronchodilators for quick relief during attacks. For severe asthma, biologic medications can be life-changing. The key for older adults is proper inhaler technique and medication adherence, which can be challenging, but is absolutely critical for effective treatment. Pneumonia and respiratory infections require prompt treatment. Bacterial infections need antibiotics, while some viral infections can be treated with antiviral medications. Supportive care, including oxygen therapy, adequate hydration, and fever management, is often necessary. Severe cases may require hospitalization. For ARDS, treatment requires intensive care with oxygen therapy and often mechanical ventilation. The focus is on treating the underlying cause while supporting the patient's breathing. Survivors often need extensive rehabilitation to recover lung function. Advanced therapies for chronic or severe cases might include nebulizers for medication delivery, immunomodulator drugs, or in extreme cases, lung transplantation. The key point for older adults is that treatments often need adjustment due to other medications you might be taking and other health conditions you might have. Never try to manage serious respiratory symptoms on your own. Work closely with your healthcare team. Having a respiratory condition doesn't mean your active life is over. With proper management, many people live full, productive lives even with chronic respiratory diseases. Medication adherence is absolutely crucial. Take your medications exactly as prescribed, even when you're feeling well. Many respiratory medications are preventive, meaning they work best when taken consistently. Learn proper inhaler technique. Many people don't get the full benefit of their medications because they're not using their inhalers correctly. Ask your doctor or pharmacist to watch you use your inhaler and provide feedback. Develop an action plan with your doctor. This should include what to do when symptoms worsen, when to call your doctor, and when to seek emergency care. Having a plan reduces anxiety and ensures you get appropriate care quickly. Stay active within your limits. Regular, gentle exercise like walking or swimming can actually improve your breathing and overall health. Start slowly and gradually increase activity as tolerated. Manage stress and anxiety. Breathing difficulties can be frightening and can create a cycle of anxiety that makes symptoms worse. Learning relaxation techniques, meditation, or working with a counselor can be very helpful. Build a support network. Connect with family, friends, and possibly support groups for people with similar conditions. Having people who understand what you're going through makes a huge difference. It's important to know when respiratory symptoms require immediate medical attention. Call 911 or go to the emergency room if you experience severe shortness of breath that comes on suddenly, chest pain with breathing difficulties, coughing up blood, bluish lips or fingernails, confusion or difficulty staying awake, or if you feel like you can't catch your breath even at rest. Don't wait to see if these symptoms improve on their own. Respiratory emergencies can be life-threatening and require immediate professional care. For less severe but concerning symptoms, like a persistent cough lasting more than 3 weeks, increasing shortness of breath with daily activities, frequent respiratory infections, or wheezing that doesn't improve with treatment, schedule an appointment with your doctor promptly. Let me give you a concrete action plan you can start implementing today. This week, schedule any overdue vaccinations, particularly flu and COVID-19 shots. If you smoke, make an appointment to discuss cessation strategies with your doctor. Start paying attention to air quality reports in your area. This month, schedule a comprehensive physical exam if you haven't had one recently. Discuss any respiratory symptoms you've been experiencing, even if they seem minor. Review all your medications with your doctor or pharmacist. Ongoing. Commit to regular exercise appropriate for your fitness level. Practice good hand hygiene consistently. Consider joining a smoking cessation program if needed. Stay up to date with recommended vaccinations. Monitor yourself. Keep track of any changes in your breathing, energy levels, or frequency of respiratory infections. Don't dismiss symptoms as just getting older. Many respiratory conditions are treatable when caught early. Respiratory health after 45 requires attention and proactive care, but it's absolutely manageable. The key is understanding that your lungs need different care as you age, taking prevention seriously, and working closely with your healthcare team when problems arise. Remember, while the risk of respiratory diseases increases with age, this doesn't mean they're inevitable. Many people maintain excellent lung health well into their 80s and beyond by following the strategies we've discussed today. If this information was helpful, please like this video and subscribe to our channel for more health content designed specifically for adults over 45. Leave a comment below, sharing your own experiences or questions about respiratory health. I read every comment and often create videos based on your suggestions. Take care of those lungs. They've been working hard for you for decades, and with the right care, they can continue serving you well for many years to come. Thanks for watching, and I'll see you in the next video.